What is a journey? It is not just traveling from one place to another. It is the things we learn, the experiences we have, the struggles we face, and how we develop as individuals. My journey through chronic kidney disease and end-stage renal failure encompasses all of the above. This is my story, from diagnosis to transplant. So let's get in position. Well, my story, it starts in the spring of 2000 in Richmond, Virginia. Hence the VUU. Shout out to Panther Nation. It was spring. I know we were coming off of the winter, going into the spring, and I had a cold of some sort, but I was really, really nasally, and I couldn't breathe at the time. I just needed something to clear the congestion part of it. And my wife kept telling me, you need to go to the doctor. You need to go to the doctor. And I thought it was just going to clear up, but it just didn't clear up. It kept going on and on and on. And so she was like, you got insurance, you got good insurance, so just go to the doctor. So I made the appointment to the doctor and to my primary care physician. And I went to my visit. And of course, you're waiting around and I can't breathe. I'm in the waiting room. So they call me. So they take me to the back. And the nurse asks, okay, what brings you in today? I said, well, I have this cold, this congestion. I think I'm good with the cold, but this congestion, I need the doctor to prescribe something for that to clear it up. She was like, okay, all right. So she said, I'm going to get a few vital signs from you. So, you know, the normal thing that they do, taking your blood pressure, you know, taking your temperature and so on and so forth. So she proceeds to take my blood pressure in my right arm. And she's taking the pressure, she's reading it. I'm trying to breathe. And she asked me a question. She says, Mr. Merritt, do you feel okay? I was like, no, I can't breathe. That's why I'm here. So she's like, no. Do you feel lightheaded? Do you feel dizzy? I was like, no, I just can't breathe. She was like, okay. So she said, I'm going to take your blood pressure one more time. And so I'm like, all right, go ahead. So she takes my blood pressure and she was like, you sure you feel okay? I said, yeah, I just can't breathe. I cannot breathe. I'm congested. You can hear I'm nasally. And she says, okay. She said, I'm going to step out the room for a second. Just try to relax. So she goes out of the room. I'm like, what is going on here? I'm trying to breathe. So some time goes by. She steps back in the room. She takes my pressure again in the right arm. And so she's looking. I'm looking at her, and she's like looking very confused. And so I'm like, okay, what's the problem here? She's like, well, your blood pressure is really, really high. And she says, for a person your age now, mind you, I'm only 29. I'm 29 years old when this happens, early 2000. I don't turn 30 until November. So we're in the spring. She's like, for a person your age, your blood pressure shouldn't read that high. And so she says, maybe it's the white coat syndrome. And I'm like, what is that? And she says, well, the white coat syndrome is, and back then, the nurses didn't really wear the scrubs like they do now, but they wore a white coat. They wore a white coat like the doctors do. And so she says, well, white coat syndrome is usually when patients come into their doctor's office or at the hospital and the white coats of doctors and getting bad news, it makes them nervous. Usually their blood pressures at home are usually good, normal. But when they come to the doctor's office, they see that white coat, they're nervous. I'm like, nah, I'm not nervous. Your white coat don't scare me. I said, I want to be here so I can get something for this. And she was like, okay, that's fine. She said, I'm going to step out again. And next time I come back, I'm going to take it in your other arm. So maybe we can get a different reading. I was like, all right, go ahead. So she stepped out of the room again. And I'm trying to catch my breath. I'm trying to breathe. I'm still congested. And so she comes back in and she's like, feeling all right? I said, yeah, I just can't breathe. So she takes it in my left arm this time. So I'm trying to relax, trying to breathe. And she's like, I said, so what happened? She's like, it's high again. I was like, I have no idea what's going on. I just need something to get me through this, to stop this congestion that's going on. So she says, okay, I'm going to the doctor. I know he was with a patient, but I'm going to get the doctor now. Because this isn't normal. You're too young for your blood pressures to be this high. And so I'm not even alarmed at this particular time. I'm just wanting something for, the congestion per se. And so time goes by, her and the doctor come in. And because she hand wrote the blood pressures, right? And so he's like, hey, Mr. Merritt, how are you? I'm Dr. So-and-so. I can't even remember his name. And so he's like, you got some very, very high blood pressures. So what brings you in here today? I said, well, as you can hear, I'm congested. I think I'm over the cold part or portion, but I just can't breathe. I'm nasally, I'm congested. I need something for that. So he proceeds to take my blood pressure. And he's like, wow, that's pretty high. And I'm like, what does that mean? And so he takes a seat and he describes to me, he says, this is not normal. I have some concerns. You being such a young man and you look healthy, he says, meaning that, you look strong enough, you look healthy. I'm thinking that there is something else going on. I said, but you're going to give me something for my nasal congestion, right? I said, because that's why I came in here. Could you give me that, please? And he's like, yeah. He's like, yeah, that's not a problem. I'm going to prescribe you something. I'm going to give you something for that. He said, I'm going to make a recommendation and I'm going to refer you to a nephrologist. And I'm like, what? A who? What is that? Wait, time out. What is that? And he's like, well, don't be alarmed. He says, but one of the things that not a lot of individuals know about, but your kidneys actually regulate your blood pressure. I was like, really? wow, wow. And he's like, yeah, yeah. And he says, being that you're such a young person, you're only 29 years old, I have some concerns. So a nephrologist is a kidney specialist. This is what he tells me. And I'm like, okay. He says, I want you to see the nephrologist so we can get to the bottom of this. And so he gives me the prescription for the nasal stuff. And I'm like, okay. And he writes up the referral for the nephrologist. So I'm like, all right. So I'm still kind of puzzled because I don't know what's actually going on here. I'm not nervous or afraid, but I'm just like, okay, like, scratching I had hair then, but I'm scratching my head. I'm like, okay, a nephrologist. So, all right. So I get home and, I'm home before everybody else. My son comes home. I think I had to pick him up from school. And then my wife comes home from work and she's like, you good? What's going on? You all right? I said, well, they did give me something for the, congestion. I went and picked that up, but he was saying something about my blood pressure being high. I don't know. And so they want me to see a nephrologist. And she's like, a what? A who? I said, that's the same thing I said. I'm like, yeah. Well, now I'm educated, right? So I'm telling her, okay, a nephrologist is a kidney specialist. A kidney specialist? But you need to see a kidney. What that got to do with your congestion, right? So I'm like, okay, all right. Let me just explain. Let me just explain what's going on. So when I went into the doctor, I go over the whole thing. I tell about the nurse going out and the white coat syndrome and all that hoopla and all that other stuff. And he explains to me that the kidneys regulate your blood pressure. And so she's like, really? Wow, didn't know that. I said, I didn't know it either. And so I got to go see this nephrologist. They referred me, so I'll call them tomorrow and set an appointment with them, and we'll see what's happening. And so time goes on. I set the appointment for the nephrologist, not too far from the house. Matter of fact, we didn't live too far in Richmond. We didn't live too far from a hospital up the road. Wasn't too far from us. And so I go to the appointment, and now I get to see the nephrologist, right? And for the life of me, I can't remember her name. I see her face, but I can't remember her name. But she was very, very nice, very, very pleasant. And she explained to me what she does, what a nephrologist does. They're a kidney specialist. I'm like, okay. And then she reads the blood work results. And so she's looking at the blood work results and she's going over it and she's like, okay, wow, your creatinine levels are pretty high. Your bun is blah, 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 blah. She's naming all these terms. And so I'm like, creatinine, what's a creatinine or creatinine? She's like, no, creatinine. So I'm like, okay, creatinine, what is that? She's like, well, that's a specific test that we do to test your blood work, and it has to be in a certain range. And yours is off the charts right now. And I'm like, oh, off the charts. And so I'm like, okay, all right. So what do we do? Or, where do we go from here? And so she says, well, I want to do a kidney biopsy. What? What's a what? I mean, I'm so young, I'm naive. I never been sick in my life. So I'm like, what a biopsy? What that mean? What you talking about? What I'm I'm really puzzled right now. And it sounds like a biopsy hurt. So I'm like, what's that? She's like, relax, calm down. A biopsy is where we go in. It's not major surgery. We just give you a little local anesthesia. It doesn't put you all the way out. You're still awake, but because where your kidneys are placed in your back here, there's a long needle. Again, you won't feel it because we'll give you some local anesthesia. And we take a piece of that organ and we analyze it. We do tests on it. We study it to see if there's any damage, to see what is causing your levels to be out of whack. So, and I've never had surgery, like major surgery or anything outpatient. The worst thing I've ever had was root canal. I hated the dentist. I couldn't stand going to the dentist because I think I was traumatized as a kid, going to the dentist and having a root canal and the fillings and all that other stuff. I never needed braces, but yeah, that traumatized me with the root canal stuff and all that. But that was about it for me. So I'm like, okay, all right, so we got to do it. So all of this is really new to us. And so I explained, go home again, explain to my wife what they want to do and that they have to do it. Again, we're still not nervous at that point. Just like, wow, this is something really, really serious, and we got to get to the bottom of it. And so at this time, I got to call my mom back home in New York. I got to give her a call, right? So she'll know what's going on with her baby boy. And so, and she knows that, I've never been sick, needing anything to this magnitude in regards to even outpatient or any type of surgery for that matter, anything, related to that. And, I explained to her what happened. I go through the whole thing from start to finish. And so she's a praying mother, thank God. That's where I get it from. So she said, I'll be there. And like mamas do, she was there, Johnny on the spot. So I praise God for her and rest in peace, Mom. So she came and we scheduled the procedure. Again, it was outpatient, local anesthesia, everything like that. It went well. They said I did well. I mean, all I had to do was hold in my breath, and because it was very delicate, because they're going through your back, but they got to be very careful because your rib cage is right there. So they said it'll be a few days before I would receive the results. And so they said, just take it easy. Don't do any heavy lifting or anything like that. So we just went home and, I took it easy. I felt fine. I was okay. But then it was time for the results, to get the results. And so we go to the nephrologist's office. I believe my wife was with me at that time because, that's very serious. So you definitely want to have someone with you, especially something as serious as that. And I hope that my brothers and sisters who suffer with this, whatever age you are, even everyone else who's dealing with anything else, I just want to say to you, it's important to take someone else with you, because you're trying to process it in your mind as to what's going on, and you may not be thinking straight. I know for me, I'm high level overview, but my wife, she's the detail. She's detailed person, and she's the best question asker I ever seen. Like, I look at her sometimes like, how you come up with that? Where you get that from? So that's just perfect. It was perfect. It was great. So you want to take individuals with you. If you don't have anyone, ask a neighbor, or ask a neighbor, something like that, because you gotta have someone with you. You gotta have the support. And I know for everyone, it's not as simple as that. So I took my wife with me, and we're sitting there with the nephrologist, and she begins to go over what they discovered. And so she says, well, Craig, what we discovered was a lot of scarring. And she had in her office, of course, she's a nephrologist, a kidney specialist. She had a model of a kidney. And so she brings it before us, and she says, well, your kidneys are made up of, especially on the outer layers, your kidneys are made up of filters. These are the filters because the function of the kidney is to filter out all the toxins, all the waste. It regulates your blood pressure. It sends the good blood back into your body, filters all the junk out. However, the filters are not on the inside. They're on the outside, right? They're on the outer layer of the kidney. And she says what we discovered was damage. Your kidneys are severely damaged on the outside. And so she tells me, and there is no repairing it. So I'm like, whoa, what you mean? You can't fix this? Like, y'all can't go in and fix it? She's like, no. Once they're damaged, they're gone. They're damaged. That's it. She says, now, we're taking all of this in. We're being educated. What I did find out was that the liver is the only organ that can repair itself, right? Other organs can't do it. The kidneys cannot do it. And your kidneys are very vital to your body, to your health. Some are saying that more so than your own heart. Even though your heart is important, the cholesterol, you want to keep that down. But your kidneys really do the work. They do the work. They're very important. And so she says, you have what we call CKD. And I'm like, okay, what's that? She's like, that's chronic kidney disorder. She's told me it was chronic kidney disorder. Many might know it as chronic kidney disease. And she said, yours is specific. And I said, okay. So we're sitting there listening, taking all of this in. She says, yours is very specific. And I'm like, okay. She said, you have, and she named it. There's a name, a long medical term for it. And it's focal sclerosis. It's so long, they shorten it to the acronym FSGS. And she goes on to explain to me, she says, she says this. She says, do you recall when you go to the restroom and you urinate and your urine is very frothy? And I'm like, frothy, what you mean? She says, bubbly. She says, you ever seen someone, like a bartender, pour beer in a glass and that foam at the top? I said, yeah, I noticed that a lot. It happened. She said, well, because of the damage to your kidneys, the FSGS, what happens is the kidney cannot filtrate the waste like it should. And what happens is it's spilling protein. She said that froth is protein, and the kidneys are not supposed to be doing that. I'm sitting there. I'm like, wow. Because we know, those of us that work out, that you need the protein to build muscles. So having FSGS, I'm spilling protein into my urine. Hate to be gross, but that's the story, guys. And I'm losing protein. I'm losing muscle mass. She goes on to tell me, and she was so great. And the way she explained it, she really cared. You can feel it. You can sense it and hear it by the tone in her voice. And she was so great. You know, the touch and everything like that, like assuring me that I would be okay. She explained that, and hear this, many African American males have it and don't know that they have it. She said, hence, it's called the silent killer, because you don't feel anything. And she's right. I didn't feel anything. I didn't feel any pain. When I went to the restroom, I didn't feel anything. I just thought it was strange that these white bubbles, this froth, would be coming out. I'm thinking it's because I was, what I was drinking. I'm a young man. Okay, I'll dibble and dabble here, have a drink now and then. But even, with water, sometimes it would happen. And she said, yeah, this is what causes the high blood pressure. There is no cure for it at all. Actually, there are 5 stages. Then it was 5 stages, still 5 stages today. She said, however, we calculated that you are a stage 3. Now, stage 3, you can live. You can live. There's no need for dialysis. With proper diet and medications, you can do well. You just have to watch your diet. And what they put me on was a low protein, low potassium diet. Now, potassium is a whole nother thing. I'm not even going to go into that because I don't want to take up too much of your time. But yeah, so I had to change my diet. It was a low protein, low potassium diet because the kidneys couldn't filtrate it and get rid of it, or the kidneys were spilling the protein over into the urine that I had to keep my protein intake really, really low. And I had to go on blood pressure medications. So, and and the puzzling part was, okay, how did this come about? What happened? What caused this? Right? So she says, okay, there's a myriad of things that could have caused the damage to your kidneys. She says, you're not diabetic, so that didn't do it, because 9 times out of 10, those of us who are African American usually is diabetic. With diabetics, and it leads to kidney failure. or we just have high blood pressure and it leads to kidney failure. And so she says, you're a young man, there's other things that could cause this to happen, this type of damage that we've seen. And she said, I said, well, what could it be? She said, well, it could be, over-the-counter drugs, things of that nature. So she's like, over-the-counter drugs, cold medicines. She said, even to, aspirin. And I'm like, aspirin? What you mean? She said, like ibuprofen, Motrin. And she goes on to say, BC powders. I said, BC powders? She's like, yeah, that could cause damage. And I'm like, oh my God. That's it. That's it. That's what did it. I'm looking at my wife and she's like, yeah. And the reason why I'm like that is because I had poor eating habits. I was in the telecommunications industry at the time. I was stressed out. I was always eating out. A lot of grease, a lot of junk. Thinking I'm a young man. Hey, I can handle it. I'm active. And so, but at the job, I was dealing with a lot of stress. And I would have these headaches. I mean, very rare for a young man at that age. I would always have these headaches. And sometimes I could even predict, not even thinking that, okay, maybe I should change my diet, right? But I would have these headaches and I would just pop these BC powders like nothing. There were even times I could remember I would just take them and don't even drink water behind it. No chaser. How about that? And so it was just, I'm not saying that you can't take them. I'm just saying watch out for them. And for me, it was an obsessive use of this particular over-the-counter drug or medication, and it was BC powders. That's what did it. That's what caused damage to my kidneys. Yep. So, yeah, that was the culprit. Well, I was the culprit, pretty much. But, that's the reason for me to tell my story. Hopefully someone has caught on to something that I said, and I'm hoping that it's helpful to anyone. Just be mindful. I don't care how old you are, how young you are. Let's just be mindful of where we are as it relates to our health. Again, if I did not go to the doctor that day, I would not have never known. There are individuals now, I'm in a few Facebook support groups, kidney support groups or dialysis support groups. And a lot of comments come out where individuals say, well, I just went to the doctor for a routine checkup and I have end-stage renal failure. Just like that. Like, wow. So, yeah, go to the doctor. Make sure you get in position as it relates to your health. I don't care if nothing's going on. Just go and see where you are. Well, that's it for the first episode of my story from dialysis to transplant. I hope you guys got something out of it. I really enjoyed sharing it with you all. And we got some more to go. I'm not going to stretch it out too long because it's really, really long. So because I was diagnosed in 2000, so I went through this for 23 years. 23 years. But I'm here to tell it. So thank God. Praise God for that. And just stay tuned. Stay tuned. We'll have some more episodes coming up. And I appreciate you guys tuning in on tonight. So don't forget, get in position as it relates to your health. Thanks for tuning in.